Some of the signs and symptoms women ignore the most are the same ones that can point to serious sexually transmitted infections. I am talking about itching, pain, discharge. And the problem is, by the time many women take it seriously, the infection has already spread. In this video, I will tell you 5 dangerous signs of sexually transmitted infections you should never ignore. 1. Burning sensation when urinating. Not just a discomfort, but burning sensation down there. That is not normal. And no, it has nothing to do with pepper or spicy food. This could be a sign of infections like gonorrhea or chlamydia. And if left untreated, these infections can affect your reproductive organs and even lead to infertility later in life. 2. Abnormal vaginal discharge. Yes, the vagina normally produces discharge, but you know your body. So if you suddenly notice a change in discharge color to yellow, green, gray, or a strong or unpleasant smell, or a thicker or unusual texture, that is your body raising a red flag. This is not the time to guess. This is not the time for self-treatment. This is the time to get tested properly. 3. Itching, sores or bumps. If you notice persistent itching, small sores, rashes or bumps around the vaginal area, please don't ignore it. Because here is something many people don't realize. Even if you use protection, you are not fully protected from all infections. Some infections like herpes or human papilloma virus spreads through direct skin-to-skin contact, not only penetration. And in women, certain types of human papilloma virus can silently lead to cervical cancer with no noise and no warning. 4. Pain during sex. Sex is not supposed to be painful. So if you start noticing pain during intercourse, especially deep or persistent pain, that is not something to ignore, because sometimes that infection you ignored earlier has moved from the vagina up into the uterus and fallopian tubes. This is what we call pelvic inflammatory disease, and it is one of the leading causes of infertility in women. 5. Unexplained fever or body weakness. Now this one is tricky because many people will say it is just malaria or typhoid, but not every fever is due to malaria or typhoid. So if you start feeling unusual fatigue, body pains, fever and headaches, especially 1 to 2 weeks after unprotected sex, please don't guess, get tested, because some infections including HIV can start this way quietly. And here is the part many people don't like to hear. You can have an STI and still feel completely fine. No itching, no discharge, no pain, nothing. But you can still pass it to someone else. And this is why waiting for symptoms is not enough. If you are sexually active, testing is not optional. It is necessary. Finally, protect yourself, ask questions, know your partner's status, and don't feel shy about it, because your health is too important to leave to assumptions. And remember, until next time, stay healthy and be kind to yourself.